Hi there. If you have any of the symptoms that I am going to list or similar ones, chances are you have hundreds, if not thousands, of gallstones blocking the bile ducts of your liver. My name is Marlon Hurlock of HallelujahLifestyle.com, and I want to invite you to stay with me through this instructional video presentation that I will be doing entitled How to Do a Gallbladder and Liver Flush. Stay tuned. You are watching The Natural Alternative. So, you must be very excited about wanting to know what these symptoms are. Well, here they are. The symptoms of a person needing to do a liver flush. Here are the symptoms. Persons having food cravings, persons having diarrhea, persons having constipation, persons having hernia, flatulence, hemorrhoids, breathing difficulties, hepatitis and other form of infection, high cholesterol, pancreatitis, heart disease, brain disorders, duodenal ulcers, nausea and vomiting, and maybe the most well-known one, what we call a bilous temper, person with a very harsh temper, unexplained harsh temper, or a angry personality, impatience, greed, fear, disease and cynicism, depression. These expressions of discomfort may indicate that a body is increasingly being cut off from the circuit of nourishment that it vitally needs. Alright, so if you are experiencing these symptoms, then chances are you do need to do a liver flush. Alright, so you don't have to take out and of course for persons having what we call gallstone attacks. Alright, so that's another reason. Alright, so cleansing the liver of gallstones dramatically improves digestion, which is the basis for a person's well-being. A little over 50% of the body's immune system is spent dealing with issues that relate to the gastrointestinal tract. So you can expect your allergies to disappear. That is going to go. You're going to experience elimination of shoulder pain in the upper arm and in the upper back. You will experience increase in energy and so on and so forth. Alright, so that's another reason why you need to do a gallbladder flush. So for many persons, including children, the biliary tubes, those are the tubes in the liver, they are blocked with gallstone, and so once that happens, then persons will develop allergies or as it relates to bronchial issues, asthma and so on and so forth. Alright, a lot of times if you do an x-ray will not show up these stones, because a lot of times the stones are very small. Alright, so there are different color stones. Some stones may be black, some stones may be red, some stones may be white, some stones may be green or tan in color. But the green stones, the ones that a lot of persons see when they do that liver flush, those green stones get their color from the bile. So at the very center of each stone is found a clump of bacteria, according to scientists, suggesting that a dead bit of parasite may have started the stone forming in the first place. And it's not unusual for persons who, when they do a liver flush, to see liver flukes and other form of worms coming out while passing out the waste out of their system. Alright, so it's very important that one gets a liver flush. So there are hundreds and sometimes even thousands of stones, and a person needs to go through about 6 to 8 liver flush to really get their health under control, to really get rid of their asthma. Alright, so it is recommended that you do a liver flush at least twice per year. So getting a liver flush is one of the most important moves that you will ever make. It's one of the second best thing that you can do to get rid of what is called a quote-unquote incurable disease or a degenerative disease. So if you have cancer, if you have any chronic disease, then you need to ensure that this is on your priority. Alright, so in our next clip, I'm going to give you a step-by-step instruction. I'm going to give you a step-by-step instruction as to how to actually prepare and take a gallbladder and liver flush. If you are not yet a paid member of our website, then you need to do so to watch this video in its entirety. Alright, so see you in our next clip.